Welcome to Now Innovating, a research to impact series at the University of Calgary. I'm your host, Julia McGregor. This episode, we speak with Sue Crawford, a nurse entrepreneur and the manager of the Health Systems Transformation Initiative in the Faculty of Nursing. The HIVE initiative empowers nurse innovators and change agents to enhance health and healthcare delivery by applying transdisciplinary solutions. Hi, Sue, and welcome to Now Innovating.
Hi, it's good to be here.
I'm happy to have you. I'm so excited to learn more today about the HIVE initiative. So I was really hoping you could tell our audience about that and the goals of this program.
The HIVE is through the University of Calgary's Faculty of Nursing. And the HIVE originally called the Health Systems Transformation Initiative. And so we've started calling it the HIVE just for short. And what we're trying to do is create more opportunities for nurse-led and nurse-informed research and innovations. And so this is a connection across campus, so working with a number of different faculties, students, faculty, and staff, but also connection to community organizations and other like patient and family partner groups.
Cool.
We have a couple of different partnerships that we've been working with these like kind of community organizations and even the Alberta Children's Hospital, for example.
And so when you're looking at like transformation, like what are you looking to change in healthcare?
Yeah, so because healthcare is going to be more of a systems thinking, we can make smaller changes with things like workflows that might make it more efficient for nurses to be able to perform those roles. It could be optimizing things like processes, policies. Nurses are mostly focused on creating like a patient-centered care and really focusing on the patient experience. So anything that can be nurse-informed that can also promote a better optimized patient experience. That's really what we're trying to focus on. Most of the stuff that's coming out of the HIVE is mostly around policy, workflow, workforce wellness, like it could be healthcare workforce wellness. So like how do we make sure that nurses are not burning out to the extent that they are? How do we make sure nurses aren't leaving the profession after a year or two, which is pretty common after, say, 2 years that people are quitting nursing completely and moving on. So how do we change that narrative a little bit? And how do we support nurses, create the leadership skills in the curriculum here at the University of Calgary, but then also supporting them once they get out into the workforce, that the system is big and overwhelming and you come out wanting to be a leader in some way, but often don't really know where to go with that. So maybe this innovation piece is the continuation of the leadership skills to get involved in research innovation at the bedside or moving out of the bedside into different community initiatives, for example. Again, changing that care landscape, changing the experience that patients have, changing the way that care is delivered, things like that.
Talking about, the important role of nurses in healthcare innovation, and Dr. Sandra Davison's a previous guest on Now Innovating, who is the former Dean of Nursing. And my understanding is she was involved in the early stages of the HIVE initiative. Could you tell us more about that?
She was one of the early visionaries for the HIVE itself. So Sandra, as the dean, would obviously having that support from that higher level to support an initiative like this, find funding for it, bring the right players in, including myself, for example, is just like get this thing off the ground and start changing this narrative about nurses also being innovators. Nurses are innovators and moving that forward. And so now with her moving on to the new
provost role. Oh my gosh.
Vice President Provost. Very exciting. It also gives, I think, nursing a really good leverage point to, as Sandra had said, to nursify. So we want to continue with that same sort of essence and that mission that Sandra had created with this. And of course, our leadership now is very supportive of it and wanting to see this come alive. And so we have, I guess, supported all the different levels to be able to, from the student side, like students want to see us looking at nursing roles differently and what is innovation, what is social impact. And obviously nurses are interested in that. And then moving into our current leadership all the way up to the vice president to have that nursing lens on it and that support to nursify. So I think it's exciting to have that, the different levels represented and have nurses at all different leadership roles. So you can see what nurses can do and how great our skills are at creating change and impacting the community.
And so you've got obviously this is all found on the expertise of nurses and what they bring to the innovation piece. And you mentioned quickly some of the community that you're working with different groups that are outside of nursing. Can you tell us more about these people that you're engaging with? Because you're really applying a transdisciplinary research approach to what you're doing.
Yes. So I guess I'll start with the nursing piece first, if that's okay.
Yeah,
so nurses offer a really unique lens on how we look at problems. We're very, as I said before, is patient-centered. So we're trying to create the best opportunity for patients to have best health outcomes and a good experience when they're interacting with the healthcare system itself. Nurses are really unique in that they have the most face time with patients in comparison to, say, physicians, for example, who still have that face time with patients, but not the amount that nurses do. So nurses really understand the patient and family experience quite intimately. And so they often see some of the different pieces that could be optimized, things that aren't working well, things that are maybe clunky and need to be addressed. And so nurses are really great, really well positioned to be able to take those pieces on. We're also, as part of what's called a nursing process, which actually is very, very similar to the entrepreneurial process, is we do a lot of iteration. And so when we say we've given a new medication to a patient, maybe for something like hypertension, high blood pressure, and we want to see if that medication is effective. So we're going to be testing their blood pressure later on after they've taken it, after a couple of hours, for example, asking about symptoms and things like that. And if that medication worked, or if it didn't, then we document that, report that to our team, and potentially make some changes to the care plan from there. So nurses are really create that pivotal role for the patient experience and patient health outcomes. Bringing that knowledge forward in a transdisciplinary way is super important because, again, nurses we're part of a larger system. So it's not just the health system, but also nurses working within with a number of different transdisciplinary colleagues. So we want to work with other disciplines so that we can understand how, look at problems in a more holistic way. So when we have our partners, for example, like Department of Biomedical Engineering, we can work with them to maybe solve real world problems that maybe biomedical engineers maybe weren't aware of, but nurses can inform that problem. And maybe the biomedical engineers then can take that and create a solution that maybe nurses didn't have within their scope before.
Can you share some of the impact that you've had so far with the initiative?
So we kicked off January 2024. And so I, as the manager for the Health Systems Transformation Initiative, the HIVE, we've run a couple of quite successful larger events. And through that, we started one that the morning was more of like a systems thinking, World Cafe conversation style. And then we moved into a design thinking, like rapid design sprint in the afternoon. And it seemed like everyone was quite engaged with that. It was a really fun event, high energy. We sold out within like a week before the event actually took place. So we had over 70 people that joined that. So that was a very exciting event. Since that, I've actually been approached by a number of different faculties and community groups asking us to do that same sort of format with the different challenges and tensions and problems that they have within their community. So something I think quite unique that's looking at that nursing lens where we're maybe going patient focused, but in this case, we're centering the problem, looking at it from all the different ways, really breaking it down, and then finding the different solutions when we bring our transdisciplinary colleagues and all these different brains together to really look at it differently and come up with solutions. So the events is one of the big pieces because we can bring people together and do that live time like solutioning for some of these different problems. We also, again, working with community groups to do research and innovation projects. So right now we're working with Kidney Foundation, for example, in the Alberta Children's Hospital. So actually running more formalized research, but with the hope of using that research as the foundation to create a sustainable solution for those community groups.
Very cool. So it must be exciting when you're running all these different events, when you're seeing these different challenges that are being put forward from the people that this challenge is being affected by, right?
Yeah, and I think it's great because when we do these sorts of events or we connect with community, it's not us telling them what they need. They tell us what they need, and we create a tailored solution based on what the community asked for. So again, it's more of that nursing approach where we're saying, we want to meet you where you're at, tell us how we can best support you, and then we're going to support that follow through.
So, Sue, you're also a nurse entrepreneur, and you've co-founded and you've been recognized for your work with the social enterprise Enable. So I was just hoping you could tell our audience too, really what Enable is and like how it began.
Yeah, so Enable is a for-profit social enterprise that connects people with disabilities to support workers. I co-founded it when I was doing my master's degree here at the University of Calgary, Faculty of Nursing. And I was able to, super lucky to have the opportunity to take some courses, entrepreneurship and innovation courses through the Haskayne School of Business. And through that, met my then co-founder, and we were able to get, I guess, some of those basic business skills to be able to found Enable. Where a lot of this came from was that from a nursing role, I still just work casually in my nursing role at the bedside. So I work with psychiatric emergency services at the Alberta Children's Hospital. With that role, what I found is that there was so many families coming in where they are just at a point of like family breakdown and burnout. And they just really didn't know what services to access. And I felt from the nursing lens, like it's difficult to hear their stories, but it's also difficult to know that the resources that they actually needed didn't exist. And meanwhile, outside of that, I was also, I've been working in the disability community for over 20 years. And I was hearing it from that side too, that all these families were attempting to try to find appropriate supports in their community so that they could get support when and where they needed it, and they weren't able to find it. So I kind of put these two pieces together going, well, would they have burnt out? Would they have broken down? Yeah. Would the divorce rate be so high? Burnout for some of these parents. And I thought maybe I can do something about it. So I decided with taking these courses that I could just venture into that area. And we started recruiting support workers. We were focusing mostly on post-secondary students. Just they have like flexible schedules, willing to work 1-2 days a week, couple hours at a time. And so we went to the Taylor Family Digital Library and started asking people about what their experience of disability, like do they know somebody with a disability? What do they know about it right now? And would they be interested in working for us? And we recruited 7 people that day.
Wow.
Yeah. And then had to kind of backtrack and go, okay, well, now we need like invoices. We need to, I already had the connection with the family. So it was just about making these like really focused matches on shared interests. So we wanted the connections to be as genuine as possible. So like if you like playing basketball, then I could go find somebody that also loves playing basketball, and you could both do what you love together. And it really hit off, and we've done over 25,000 hours of community support.
Wow.
Yeah, so it's been fairly successful. We've made hundreds of matches over the last couple of years, and really just changing the care landscape for people with disabilities, that they can get support where and when they need it.
That's fantastic. And so I was curious too, because like obviously you saw the need for this through your work, through both your roles in nursing side, and like, so was it hard to get? It doesn't sound like it was hard to get buy-in though, to really make this like social enterprise actually reality, right? Because you're talking about, finding the post-secondary students to help like, facilitate the move. But like, is there an insurance component as to, or like as a support service? Like how does that work?
Yeah, so structurally, it's actually very difficult to do. It makes sense to do, again, because like a lot of students are looking to build up their resume. Yeah. Maybe they're interested in going to grad school or going into medicine, for example. So most of our support workers are post-secondary students who the reason why we have any attrition is because they've gone to Ontario for grad school, for example, or got into medical school. And so I had a lot of very high-performing students that were very excited about this role and wanted that. Families very excited, and it's very low barrier to have a student come into their home. Like if I'm like, oh, I have a second year undergraduate nursing student, it just sounds really non-threatening. Yeah. And so it's like really like great. And it's somebody young, energetic, who's like happy to get on the floor and play with like a 5-year-old with Down syndrome, for example. So really great connections that way. Those were not the barriers. The big barriers were, insurance. We didn't work only with minors, but a lot of very vulnerable people, whether they had a disability or they were under the age of 18. So that posed a significant challenge. The other thing was around transportation, for example, like driving to and from activities. A lot of post-secondary students now, a lot of them don't have vehicles at this point, so they're taking transit. So that eliminated a bit of that liability piece on that. And the other aspects are around government funding. So the government funds the actual hourly wage for the support workers. And so a lot of families, they already have access to that funding, but the funding is quite minimal. And so families have to top up. So it makes it a little bit difficult for some families, lower income, to be able to top up that amount to actually make it a reasonable living wage for somebody to take up that role. So it was actually, the system was the biggest barrier with it, as opposed to the actual, like creating matches. it came really natural.
Yeah.
People got along really well, and everybody's very excited about it. It's life-changing for a lot of people. But yeah, the system
how to support
aspect is very difficult. And because we're changing the way that care was already being delivered, it was difficult to really break into that space. But perseverance got me through it. Just keep on asking questions, keep on talking to people, keep on asking why, and trying to find a solution so that, again, we can meet the needs of these families.
Yeah, I think people realize that service delivery is a whole another ball game of all these things to consider rather than just like, I'm selling a product and that's all I got to do.
Yeah.
Nurses play such an important role in healthcare innovation, I think, because they're on the front lines. Like you see the problem areas, you have ideas, you can see how best to support patients. And the HIVE initiative really emphasizes this. So what advice do you have for other nurses who are looking to really start on a pathway to social innovation or starting a social enterprise like Enable?
So for my fellow nurses, is just, again, same sort of thing, is just asking those questions, using that passion, whether it's a population that you're passionate about, maybe it's like, for me, it was kids and young adults with disabilities, and turning some of that, I guess, anger that you might have. Like I felt really frustrated with the system, and I really felt for these families. And I took that and I turned it into something that like allowed me to have that perseverance. And I think a lot of my nurse colleagues have similar personalities or similar aspects where they want to take on that challenge and create a sustainable solution for it. And I think nurses, one of the challenges are nurses don't necessarily see themselves as innovators, even though they are innovators. Everything they're doing throughout the day is innovation. And as I said, the nursing process and entrepreneurial process, they're fairly similar. So if a nurse can recognize that they're an innovator, that they're creative in their thinking, that they exist within this system and they might have some really good ideas to be able to create change, that if they can build up that confidence to take that next step and step out of kind of that day-to-day, maybe like floor nursing, kind of more stereotypical nursing role where we're at the bedside, but nurses are in so many different leadership roles that they can step out into that leadership role and create huge changes for patients. In the community, nurses are very well respected. So a lot of the different pitching that I did and promoting for Enable at the time, as soon as I shared that I was a registered nurse, a lot of people just immediately trusted that I had a good idea of what their challenges were and was there with their best interests. Yeah. So I think a lot of nurses can leverage that, the nursing expertise, but also the respect that nurses have to be able to get their ideas off the ground, move to the next step. Through the HIVE, we have what's called the Social Impact Starter Series.
Oh, cool.
And this was, so it's about leadership and soft skills training. Again, because we've identified that some people just aren't really able to take that next step forward. Yeah. And so this allows kind of that training on, like we would do one session on pitching and public speaking, trying to understand your story, coming up with your problem statement or your value proposition. And so it's kind of that very beginning pre-step to say, okay, let's recognize what is it that you're passionate about? What are you working on? What is the problem you're trying to solve? And how do we communicate it to a larger audience? So I agree that it's a big challenge to move from where people are at into this next step, but it's really just cultivating that, whether it's anger or like passion or a mix of the two things, and using that to change the care landscape in some sort of way.
I'm really looking forward to seeing as HIVE, continues on the initiative, like seeing other impacts and like these events you're doing and these challenges you're tackling and presenting these solutions. It's so really exciting, and I really appreciate you coming today to tell us more about all that great work you're doing and just really how nurses can innovate and be real leaders in this space. So thanks so much, Sue.
Yeah, thank you.
You can find links in our episode description to learn more about the HIVE initiative and Enable. And of course, to learn how to move your research to impact in the UCalgary innovation ecosystem, visit ucalgary.ca/innovation.